Good evening, students. Today we'll be discussing about the ophthalmic division of the trigeminal nerve. So it is the smallest of the three divisions of the trigeminal nerve. Enters orbit through superior orbital fissure by dividing into three branches: nasociliary nerve, frontal nerve, and lacrimal nerve. You can see here. So three branches entering through the superior orbital fissure. The nasociliary is entering through the common tendinous ring, whereas the frontal and lacrimal are passing through the lateral compartment of the superior orbital fissure. So this is the frontal nerve, this is the lacrimal nerve, and this is the nasociliary nerve. You can see here, this is a communication branch from the nasociliary nerve to the ciliary ganglia, and from there you can see the short ciliary nerves. So here are the long ciliary nerves, and this is the posterior ethmoidal nerve, and this is the anterior ethmoidal nerve, which is a continuation of the nasociliary nerve, and this is the intratrochlear nerve. You can also see a communicating branch coming from the zygomatico-temporal nerve to the lacrimal nerve, conveying postganglionic secretomotor fibers to the lacrimal gland. So one of the three branches of the ophthalmic nerve is the lacrimal nerve, enters orbit through lateral compartment of superior orbital fissure, receives communication from trochlear nerve, receives communication from zygomatico-temporal nerve, which has secretomotor fibers to lacrimal gland from pterygoparietal ganglion, passes forward along upper border of the lateral rectus muscle, supplies sensory branches to lacrimal gland, conjunctiva, pierces orbital septum, skin of lateral part of the upper eyelid. So frontal nerve enters orbit through lateral compartment of superior orbital fissure, passes forward between levator pulmonary superiorus and roof of orbit, divides into supratrochlear and supraorbital nerves. Supratrochlear nerve is small, passes above trochlea of the superior oblique, gives a branch to intratrochlear nerve, curves upward along the medial part of supraorbital margin, gives branches to conjunctiva and skin of the upper eyelid, supplies skin of lower part of the forehead. Supraorbital nerve runs upward through supraorbital notch or foramen, gives branches to conjunctiva and upper eyelid. So beneath frontalis divides into medial and lateral branches and supplies skin of forehead and scalp as far as lambdoid suture. So few branches supply mucous membrane of the frontal sinus. Nasociliary nerve enters orbit through common tendinous ring of superior orbital fissure between the superior and inferior rami of oculomotor nerve. So crosses above the optic nerve from lateral to medial side along with ophthalmic artery, reaches anterior ethmoidal foramen of the medial wall of orbit, where it is continuous as the anterior ethmoidal nerve. It gives 5 branches, namely communicating branch to ciliary ganglion, passes forward along short ciliary nerves without interruption. Then long ciliary nerves 2 to 3 supply ciliary body, iris, cornea, and dilator pupillae. So intratrochlear nerve emerges below trochlea of superior oblique muscle, supplies skin of both eyelids, adjoining part of side of nose, lacrimal sac, and lacrimal caruncle. Then anterior ethmoidal nerve, which is a continuation of the nasociliary nerve, passes through anterior ethmoidal foramen and canal, appears in anterior cranial fossa on upper surface of cribriform plate. On reaching the nasal cavity, divides into medial and lateral internal nasal branches. So respectively, you can see the medial branch is supplying the anterior part of nasal septum and lateral branch is supplying the anterior part of lateral wall of nasal cavity. So lateral branch of the internal nasal nerve emerges below the nasal bone as the external nasal nerve, which passes below nasalis and supplies skin of ala, vestibule, and tip of the nose. So posterior ethmoidal nerve, its slender branch traverses through posterior ethmoidal foramen, supplies ethmoidal and sphenoidal sinuses.